This is a difficult diagnostic situation, and these can get the best of any of us. And there's a couple things I'll do in these situations to try and approach them in a very systematic fashion. And the first thing I want to bring up is how I talk to the patient in these situations. I'll probably do a little more education than I normally would. Some patients take to that better than others, but I'm going to spend a fair amount of time educating patients about pulpitis, about the fact they have a lot of heavily restored teeth. I'm going to show them the proximity of the restorations to the pulp, talk to them about pulpitis versus necrotic teeth. I'll talk about reversible pulpitis versus irreversible pulpitis. And it's some patients are going to take to it better than others, are going to understand more than others, but in their terms, in terms that I think they're understanding, I'm going to try to give them a better appreciation for what we're up against. And one thing I would stress to a patient in this situation is that this may be more than one tooth. And particularly in this case, their symptoms are kind of varied. They're kind of describing in one case, teeth that are sensitive to cold, in another case, a spontaneous throb. So yeah, there may be in one case an endodontic problem, in another case a matter of some restorations being replaced or revised. So I'm going to be talking to them about that. I'm going to be telling them that way they kind of have an expectation. Hey, this could be more than one tooth. This could take some time, and it kind of gets them on the same page as you. So before I talk about the next thing, I want to show you a little bit of the bone on the distal aspect of this tooth is a little bit suspect. I can't tell you how many times I see cracks in the distal marginal ridge of lower second molars, but I do encounter those a lot. So that's one little particular in this case. Also, if we look at the periapex here, this is a little bit suspicious. I feel like we lose the continuity of the PDL here. This bone is a little bit suspect. It doesn't have the same consistency as the other bone. So I'm suspicious of this tooth. I'm not saying it's that tooth causing the problems or even one of the problems. It may be a red herring showing up on the film. Diagnosis is a matter of putting a lot of pieces together into a puzzle, into a mosaic to give you a picture. So next thing I want to talk about is the testing. When you're doing testing on these teeth, you want to get a good baseline for your testing by doing anything that you're going to do in this area. Do it on the other side of the mouth, not just the opposing arch. Do it on the other side of the mouth. Explain to them, let's say it's the cold test. Explain to them, this is going to feel cold. I need you to tell me when you feel the cold. I'll get the cold off as soon as you feel it. And then, you keep talking to them. Has the sensation gone away? You have to do this dialogue and establish this baseline for this particular patient. I mean, if you test patients regularly, you get a better feel for endo testing, but no matter how many times you've done it, you still need a baseline for that particular patient because none of them are alike. They kind of talk about these things in a different way. And, quite frankly, there's times when the way they're reacting to the cold or percussion or whatever the particular test, it's useless to me because I can just tell I'm not going to get good answers out of this patient. And so that, you got to deal with that when it happens. So those are the two main points I wanted to make. Also, I think it was Kareem earlier that said, this recent filling, you redid it and it's really right on top of the pulp. So, when patients have problems, I'm always looking at the last dental work done. That's kind of another rule of thumb. What's the last dentistry you had done? But it seems like there were symptoms before that. But again, get the patient on board, get a good baseline for your testing, do your testing when the patients are not on Advil or Tylenol. Good luck with it. This is a tough situation, and they do come up, thankfully, not all that often.